relevant conversations too, especially for a lot of the people out there. All right.
How are you?
How's it
Yeah,
going?
Jason,
How are you? Albert Ramos. Nice to meet you.
Nice to
Javid?
meet you, Javid.
Javid, I'm Albert.
Yeah, I was listening to one of your uh, podcasts.
Oh,
actually.
good. Which one was it about?
The DeepSeek one.
Oh,
Okay.
yeah. Okay, so and I haven't chimed in on anyone. Yeah, if we want to get you closer to the mic so people can hear you. I haven't chimed in because we've heard DeepSeek now a couple of times, and I'm just waiting. I'm wondering if you're going to say it first or am I going to say it? Because we've had some healthy debate about DeepSeek. What were your thoughts about that? So people can find it on our LinkedIn, but also Spotify was one of our season 2 roundtables.
How about let's get to know him first?
Yeah, of course. Sorry, I was going to go right into it. You got me so passionate about DeepSeek. No, yeah, walk us through. Who introduce yourself and let's start there.
Yeah, sure. So Javed Muhammad. So actually, I run a dev studio called Bitsol Technologies. So we started back in 2015 with the focus of helping startups. Even actually before that, I ran my own startup.
Oh, excellent.
Got paid, right? It was not a success, so then I imagined I can help others as well. Not to what to do, actually to how to avoid those failures.
Watch out for it.
Yeah, because I learned from that. So it went well. So we helped till now more than 100 startups, but we got a good chance to work with the likes of Johns Hopkins, Headquarters Abu Dhabi, the Libyan government during the COVID time. So those some big brands as well.
Wow.
So now we are into AI. Everyone is into AI, so we are also into AI.
I love it. I always say success leaves clues, but so do failures, and it's okay. We learn from them, right? And I wish more books. I think valuable books, leadership books, are actually the ones that tell you what not to do or what to watch out for. Like kind of like a parent.
Here's all the challenges I went to. I just finished reading Shoe Dog, and
so good.
It was, half the book was all of his failures and how
Yeah.
hard it was to be able to become a multi-billion-dollar company.
Yeah, it's so good. That's a very timely book. I mean, you can go back to that one a ton of times. Well, that's exciting. So you know the ins and outs. We had someone that is currently actually 2 guests that were.
It's a very entrepreneurial group.
It is bold entrepreneurship. That's the theme.
That's the theme, and everyone is up to for that.
Yeah, it's been exciting. Well, here now let's get back to DeepSeek. We're back. DeepSeek, we're back because I want to talk about this. So why don't you walk us through so that people can find it on our Spotify, LinkedIn, all the platforms, right? So we had a pretty lengthy chat because it disrupted. Someone mentioned that earlier. It disrupted the market. NVIDIA. It had some bold claims about the investment that it took to get there and the cost reduction and all of that. Although I think there's a lot of noise around the chips and the hoppers and anyways. And then the data security. So as you watch that and use your doing your research and homework, especially for these startups in AI, what were your thoughts? What's your thoughts on DeepSeek and what's going on even outside of that?
Yeah, sure. So I'm not that technical now.
Me neither.
I was technical, but I feel like it's actually a big win for even the US market as well. The reason I'm talking about because we are working in AI domain. So before that, getting that ROI of AI still not defined, right?
Right.
So we are doing a lot of stuff, but we don't know how to make money out of it, right?
Interesting.
So we work with many startups. Those went into shelf just because they don't know how to get the money that is being invested, right?
You're saying their idea was just they just got put on the shelf.
So yeah. So the whole product actually. So the main core reason was actually how to get the investment back because now running the AI models, these are costly, right?
Right.
So with DeepSeek invention, I feel like the other big players now started to thinking how to make it cheaper, right? Because they need to stay in the market, they need to stay in the competition. Otherwise, the competition is gone. So that will bring the cost of not only the building AI, actually running those models as well. So when those models cost come down, so then the ROI will come actually. Even for the smaller companies as well, especially for the startups, right? They are targeting a smaller businesses to get the revenue out of it,
Right.
and they don't have that much budget, so they want a cheap models or cheap solutions the model can run on, right? So
But they want it to be knowledgeable, and I think that's a great thing because limiting that capex cost that it's going to take to be able to build out a model and build out your product. DeepSeek completely disrupts that, and that's going to definitely be a net positive. So I anticipate you got a lot of different products that are brushing off and rethinking their strategies again.
Yeah, that's true. And another positive impact that I see is like a lot of investment was going into the infrastructure as well. It's still going on,
Yep.
but at least there will be some thoughts about that as well now. So might be some investment will come on the software side as well, right?
What are you seeing and we don't have to talk about the exact right product, but maybe the category? What's been like the maybe surprising or the hottest, I like to use the word sexiest, like area that dollars are starting to go, not infrastructure, but something else. What are you seeing is really the upcoming that maybe people are thinking about, or if you're allowed to share?
Yeah, so I was reading actually article. So in January there was 12 unicorns, and out of 12, 5 from the healthcare industry,
Interesting.
right? So that tells a number that where the investment is
Was
going
one
in
of them
future.
these like smart utensils? That was one of our guests. That was one of our guests. Wow. And so the healthcare space. Now, when
But
you say
that, I mean,
healthcare,
that's
like,
absolutely right, because healthcare has been on legacy technology
Oh my
for
goodness.
years. You know, I mean, just dealing with the antiquated systems just to go to the doctor's office is they're ripe for disruption and
Right.
change.
Well, think
And-
about documents too, and we have a case example at White Glove when, I mean, we're working with municipalities that have a ton of medical records. And Jason, I know you've been really close with this, and before we kind of loop back here, do you want to just share what we're doing in McKinney and some other places?
Yeah. So we've got our products embedded in a few proof of concepts where we're able to digest vital records for one of the largest companies or one of the largest counties in Texas, and we're able to within 5 seconds be able to take a document from the 1930s all the way up to the 1960s, and you know they write different than the way that we do now, and stamps are all over the place, and we're able to process it with very good accuracy results. So it's definitely something. We've got a couple other opportunities. We're helping with documentation for, you know, you get done with your consultation, and doctors have to write up, or traveling nurses have to write up all of that information, and it's not always correct, or you know you do it at the end of the day and you just met with 7 patients, like, oh, what happened to that one at 9 o'clock?
Right.
So being able
It's a
to
data repository, which I love. And the other thing about it, right, just doing the math, this project, which would take this the city about 42 weeks to do with a team of 20, right? Think about how much they're being paid on a payroll, and let's just assume this is all they're doing during their 40-hour work shift. It's over the year, it comes out to about 600 grand. That, you know, as a community member, I'd like to know that what our city is doing, what they're spending on. Well, that's what they're doing. But yet you introduce this new technology that can do it in 5 seconds, and they're no longer have the guardrails of a
and
40-hour
24/7. It's not 40
and
hours.
24/7, right? And you know, I won't throw the price out there, but let's just say you're saving about close to 600 grand, close to 550, let's call it, to the bottom line. I mean, as a community member, I love that. And now we get to reposition maybe some of those funds elsewhere. I mean, it's just amazing what the technology can do there. Healthcare, so interesting. Now, when you say healthcare, is it more of like the hospital medical office, or is it health and fitness? Is it wearable technology? What do you mean by healthcare?
So I think it's coming in almost in every field of healthcare, starting
Okay.
from even the biotech, from the
Right.
digital health. So all that part is disruptive.
Love
So
that stuff.
one reason is because healthcare always have a shortage of staff, right? So whenever AI is coming to solve those problems, it's not going to take those jobs, but it will be facilitating them
Right.
to do more work. Like if a physician is taking 30 minutes to do a documentation part, like
Describing, yeah.
describing,
Some
or even
notes.
filling the forms like 837, right? So now AI can do all that part.
Yeah.
Not only AI can do that part, AI can even suggest do better than at times humans, right?
Right.
Because AI can go and see those cracks that generally
And
would
they don't
miss,
have the
right?
same constraints.
That's true.
So if we have, for instance, my best friend from college, I was talking about my college earlier. His name's Jay. He's an orthopedic surgeon, and I know whether it be the soap notes or I think what scribing, that they'd have a scribe. They don't have to do that anymore. That being said, I'm sure the question will be, well, what's the investment? Like, what does that look like? Is that fairly affordable for, let's say, a surgeon or some sort of a doctor to say, I want AI baked within my infrastructure so that everything's transcribed. I don't need to write anything, nor do I need to hire someone to write it.
Yeah, sure. So one of the startup actually we work with, and they're doing good as well right now. So they are just charging around $10 to $12 per month. that's nothing, right?
Compared to
So-
the payroll and the time.
Yeah.
Especially a physician's time, right?
Right.
That's an expensive minute and hour.
Right. So with that kind of like pricing, I don't see it's like even a pricing is a question now.
It's a no-brainer.
Right. So it's the only thing is how accurate that model is. So the output will be the key factor right now, especially on the scribing side, because there's a lot of companies, there's a big competition, the pricing is down. The only problem is right now the quality.
and the privacy.
Yeah.
Yeah,
That's
and-
Yeah,
another
I'm
thing.
curious about that. Let's talk about that because we've talked about risk mitigation and privacy, data privacy, but HIPAA, when you throw HIPAA in there, it's even more guardrails and red tape you need to get through to make sure, right, nothing's being leaked out because that's a major issue, right? I mean, you're done if you break some of these HIPAA violation rules and all that and regulations. What have you seen?
I think the minimum fine on the HIPAA regulation is 10 million. Think about a startup, right?
Yeah.
So, so
That's it. Closing the doors.
yeah, so that's a problem. But the good thing is, like with all major EHRs, so they provide standard API Firebase integration. So you can read that data, you can write that data back, and if you keep that part, like the modeling part, and not saving the data in your own database and all that part, because you already have the system in place
Sure.
that can use to read and well as the right data. So you need only data for the processing purposes, right? So you just need to take care of that part. If that part is covered, so I think you are good to go.
And I think that's why healthcare hasn't been disrupted. And now with AI, it helps augment a lot of that. Why it's now able to, because you can build that security and you can make, provide that governance and enable that to make it so that you can start disrupting this market. So it makes complete sense of why AI is now being driven very effectively across the medical space.
I'm excited about the medical space and healthcare. Any other industries you're excited about?
Yeah, so we are working in education as well.
Yes, I was
education.
hoping someone would chat about this today. Now we did talk to our professor earlier. Yes, but we lightly touched on it, right? It was more marketing focused. But I'd love to talk to you about the education space. What are you seeing? What's going to happen?
Yeah, so actually, I was attending a couple of education conferences as well. The last year, the big ones. So right now, the technology is divided mainly between the teacher side, or I would say the educator, and then the student side. But the 80% of the work is being done on the educator side.
Right.
So the student side is still not covered. People are still not able to digest, even if AI is applicable for students or no. But I think other way around, because those are the people who can use those technologies, right? You can't keep them away. But how to use that ethically? That's the big question.
So we've got a proof of concept under White Glove to do that as a tutor that's there to help them, because we see the same problem. We've spoken to teachers, and the teachers are teaching to the middle of the class. The ones that are ahead are bored because the curriculum they already know, and the ones that are behind are too afraid to ask the questions. So having that digital tutor that's there to help you learn the concept, not give you the answers, because you've got to tone it back from what you get from ChatGPT and other Gen AI tools, because it'll give you the answers. You've got to be able to help them learn, and I think that's where we've got a product that I think is going to be very influential that we're starting, and I think that's really where we see the market going, is being able to be a tutor and an assistant to help the students.
Yeah, and
I love it.
and even the bigger part is the personalization. So if you are able to add anything related to the personalization, because my teaching needs are different as compared to you, right?
Exactly.
Even we are in same
some
class,
analogies
same
work
teacher,
really good for me that don't work for you.
Yeah, so I have a different personality, I have a different culture background, right? So everything is different. So if we can build that in, and I think like a personalized AI tutor for students, something, if someone able to achieve that, I think we'll be very close.
Well, you can do it right now, right? So my son, his name's Jameson. He's a 7-year-old in second grade. He's doing 8th grade math, and it first started at 5th grade math, right? And I said, he's a mathematical whiz. he won't play sports. I try to force it. That's my second boy, Henry. He's the athlete. Jameson is the math guy. He's the Minecraft guy, right? And it's great. Yeah, I love it. He's a builder, and he thinks at a different level. So I said, I just got to pour into that, right? And so I built a GPT, right? Configured it to one, chat with him. Jameson, your mom and dad love you, right? Like, it's on our side. It's telling him all these positive affirmations, but then it's going back and forth. It will not give him the answer. They'll give him clues if he asks for it, but he cannot wait to come home and go on it and say, give me a hard math question. Give it to me harder, right? If it's too easy.
So let's start getting them in to start building some of these apps.
I know, right? Yeah.
It seems like a perfect,
we need a technical person
engineer.
in the Ramos family. Yeah. So, so he started doing that, and I'm like, wow, I'm so interested in the educational space. I know we have our product as well, White Glove AI. I think this technology can really enhance our kiddos, our students, right? Especially domestically, we need it. Like, you see the stats, you see where we're at domestically when it comes to education. We need the technology to really give us that boost again, and get our kids back on track. So
that's true. One comment on that. So eventually, technology will get in, right? So our kiddos, they will be using that. Yeah. How they will be using it, that's up to us. If we build a better technology that can safeguard them from the bad things, that will be even better for us.
Yeah, that's great. Wow, such a pleasure. We talked about a lot. We talked about education, right? We talked about startups. We talked about the healthcare space, medical. Yeah, and I'm sure I could continue to pick your brain and go through. You're probably dealing with a ton of different, as you mentioned, startups and ideas. And I'm glad they're off the shelf now, that it's cheaper, right? We brought up DeepSeek, and we didn't hit it too hard. But
it's a long day. You got to play the long game.
Yeah, we got to play the long game. Come back. We'll talk about it. So great. Thank you so much for your time. Yes, great chatting with you too. And where can we find you? Can we find you on LinkedIn?
Yeah. So Javeed Muhammad. So I'm just search with the name of BitSoul, so you will be able to connect with me.
Excellent.
Just send me the.
Yeah. So make sure to reach out, and if people are thinking about starting up, is that where they would go? Find you on LinkedIn? And
yeah. So anyone have any idea? They are thinking, okay, so how to start it? So we are the team. So we start with from. Like creating wireframes, sketching it out, even do the discovery part to understand actually what that person is trying to do. Because we work more than 100 startups, so we know what to do, what not to do, right? So we can help them, and then definitely on the development side.
Yeah. I just met someone that I'm going to share your information with them. It's in the travel agency space.
Oh, okay.
Very curious about where that's going to go, including just being powered by agents and AI, and I think that industry is also going to be transformed a bit. So we'll chat.
Sure.
Yeah.
Sure. Nice to talk to you.
Yeah, great chatting with you too.
Nice
That was amazing. Woo! It is energized in here.
It is all over.
I mean, healthcare space, which I love, and I love that one. That one's an interesting space because I think there's not a lot that I think is at risk for full-on replacement because it's so specialized.
Right.
I'm curious what the audience. I'm curious what you think about.
I think there's probably a lot more than you're expecting because it's been neglected technology for years.
Right.
And now that you can start easily understand what the HIPAA requirements are, how to build those HIPAA requirements, it's not as expensive as it used to be. So this allows you to disrupt it. And I think we may get Bindu in here later, who's got some really great use cases.
Yeah, I saw her earlier.
That we may be able to dive into of how we're helping, but how she's thinking about the healthcare space and how to disrupt it.
All right. Well, I think it's looking at the schedule here, and we have an Alok Mascara who is with Lennox, actually was on one of the panels. So I think we're ready to rock. We're gonna wave him over.
We're gonna get one minute. I've got to go.
You gotta. Okay, no worries. Yeah, here. Too much 7-Eleven Fusion. Yeah, sponsored by 7-Eleven. So yeah, so I'm excited because we have a lot of bold entrepreneurs, as the themes are.